Dr. Schaefer, thank you for joining us today.
Well, thank you for having me, Bill. I really appreciate the opportunity.
Now, there's an old, I don't want to say canard, but there's an old saying that if you live long enough, you're going to develop prostate cancer. It is something that all men should be aware of.
Well, I think as a general health consideration, absolutely, men should know about prostate cancer. What you say is true. Many men who are older will have prostate cancer. But the way we think about prostate cancer today is not whether you have it or not, but if you if you have a life-threatening prostate cancer or not. And so we don't worry so much these days about these little itty-bitty ditzel indolent cancers. We really worry about the more aggressive ones. And I think urologists today, urologists at our Urologic Cancer Institute here at Northwestern Medicine do a great job of discriminating or identifying the lions from the pussycats.
Exactly, and hit the lions first, but maybe you want to catch them when they're pussycats. So what are the signs and the symptoms of prostate cancer?
Well, these days, prostate cancers generally don't have any major symptoms. And that's because we have two very good ways to pick it up while it's early and it's more in the pussycat stage than the lion stage. And that involves a blood work called a PSA blood test, and it involves a rectal exam where we feel the prostate. And with those two tests, very rarely do men present with prostate cancers that have already spread somewhere else in the body or are causing local symptoms. So today, only about 5% of men who have prostate cancer will have any symptoms. And that's really just a credit to the very effective screening tools that we use, that blood test and the rectal exam.
Is there a certain age where you should start being more concerned about prostate cancer? Or is it basically something you should be thinking about not thinking about, but be concerned with for most of your adult life?
Well, that's a great question, Bill. And prostate cancer is a cancer that is associated with age. So yes, men in their 20s and 30s and most men in their 40s don't have to worry about prostate cancer. Generally, the idea of screening for prostate cancer is something that begins with a discussion with the individual patient's doctor. And the recommended times to begin discussing that for an average man is around 50 to 55. Now, men who have a family history of prostate cancer, men of African ancestry, and men who have a family history of breast or ovarian cancers, those individuals may want to bring up the idea of screening for prostate cancer at a younger age, because those individuals may be at increased risk for being diagnosed with or developing prostate cancers, and sometimes prostate cancers that are a little bit more aggressive. So we definitely want to know about those things.
Now, you brought up the African American, actually, according to the CDC, African American men have a higher rate of prostate cancer and are more likely to die. First thing off, is it because they don't get the health care, or why is there such a disparity?
Well, it's a good question, and we don't totally understand what the reasons are of those statistics you quoted. I think part of it may be access to care, and part of it may be that the disease, the cancer itself, is different in terms of its aggressiveness. Now, the good news is that there's emerging data that says if you're African American and, for example, you have more aggressive advanced prostate cancers, you on average actually respond better to standard treatments. And that's based on some emerging data from reviewing a lot of clinical trials done all over the US and the world. So I think if you're African American, we encourage those individuals to be really progressive and interactive with their internists and their doctors, number one. And number two, if you're African American, you're one of your listeners out there, and you do get diagnosed with prostate cancer, you certainly shouldn't throw in the towel and give up hope. In fact, most treatments work very well in African American men, and sometimes they actually work better in African American men than in Caucasian men.
And that's another point to be brought up, is that prostate cancer is one of the more treatable cancers, especially if it's caught early enough.
That's right. It's an absolutely treatable cancer, and If you look at all comers who have prostate cancer, their 10-year survival is 98, 99%. So pretty darn good. Obviously, you know, we have a whole urologic cancer institute here at Northwestern Medicine, and the design of our institute is to really help out those 1 or 2% that have a more aggressive disease. We're looking for better treatments, better, newer cures. And so we haven't just relaxed because the numbers are 98, 99%. We're really full throttle ahead.
Yeah, when I hear the word cancer, relax is not necessarily the first word that comes into my mind. Before we go any further, can we get more information on prostate cancer and also about the Urologic Cancer Institute?
You sure can. And Northwestern Medicine has a great web page to get resources. General web page would be nm.org. Our Urologic Cancer Institute can be found at nm.org/Polsky. Michael Polsky is our tremendous donor who helped make this happen. So nm.org/Polsky, Polsky.
A lot of people fear biopsies because they think, and again, this is an old canard, that biopsies cause cancer to spread. Should we just eliminate that as a possibility right now?
Yes, biopsies do not cause cancer to spread.
Any other misconceptions people have about prostate cancer, or maybe even cancer in general?
Well, I think that there's a lot of confusion about prostate cancer. Should you be screened for it or not? I think that screening done in a thoughtful way reduces prostate cancer deaths. So one of the big misperceptions is, well, you don't need to screen for prostate cancer; it doesn't work. That's not true. Now, other misperceptions are that you can give prostate cancer to your significant other with intercourse. That's not true. And I think the other misperception is that if you get diagnosed with prostate cancer, every cancer that you have has to be treated, and that's not true. It's thought that about up to 1/3 to 40% of new diagnoses of prostate cancer are cancers that are so small and so minimally aggressive that we don't actually need to treat them. We can monitor them. So a lot of things are changed, and I think that Northwestern Medicine's webpage, nm.org Polsky, they have a tremendous amount of resources to help an average patient really navigate this sometimes complex, landscape, the space.
And a quick word about the Cancer Institute, which got started or is benefiting from a very generous gift.
Yeah, so Michael Polsky is a Chicagoan. He's a renewable energy entrepreneur, a totally amazing, inspirational guy. And he has a family history of prostate cancer. His father and his grandfather died of it. And he's been a friend of Northwestern Medicine for many, many years. And so through a series of discussions, he was really inspired to help us bring, better, more comprehensive cancer care to our patients here in Chicago and the Midwest and all over the country. And so we're very grateful for Michael and his thoughtful gift.
And once again, a place to go for information about prostate cancer and about the Institute?
www.nm.org/Polsky.
And again, if you, first off, get checked for prostate cancer, and the good news again is that it is treatable, and you can certainly get a lot of information about that and more. And with that, we say thank you for joining us today.
Thank you for having me. I really appreciate it, Bill. Have a great day.